It might seem a bit strange, but keeping a note of the color of your period blood can be a helpful part of tracking your health, as well as logging your emotions and symptoms. It's normal for the color of period blood to change throughout your cycle, but some of these colors might be a sign that you need to visit your GP. So understanding this is actually pretty important. Bright red blood is most likely to happen at the middle of your period, when it's heavier. This color is an indicator of fresh blood with a steady flow. If you're feeling as you normally do on your period, this is completely normal and nothing to worry about. Brown or dark red blood is normally seen at the start or end of your period, when the flow of blood is a bit slower. This may mean that the old blood is reacting with the oxygen, called oxidizing, and becomes darker. This color is also quite common during your period and is nothing to worry about. Black blood is also commonly seen during the start or the end of the period, when the flow of the blood is also slower. This means that the blood has stayed in the body for longer, resulting in oxygen reacting with it and creating a darker looking blood. If you have some darker looking blood and you feel fine, this is usually nothing to worry about. Sometimes black blood can be associated with a vaginal blockage, where the blood stays in the uterus for an abnormally long amount of time. Vaginal blockage can happen when something is in the vagina that shouldn't be there. For example, a forgotten tampon. Other symptoms of vaginal blockage include bad smelling discharge, fever or difficulty peeing, and itching in or around the vagina. If you have black blood, or you notice any of the symptoms that we've mentioned, or you're feeling unwell or you're worried that something is stuck inside the vagina, it's important that you get urgent medical advice from your GP. Pink blood can indicate that the period blood has been diluted with cervical fluid, which is usually quite clear, or it could mean that estrogen levels are low, which could be because of the use of birth control, leading to a lighter period. It can also indicate anemia, which is where you have fewer red blood cells. Other reasons can include significant weight loss or diets that are low in iron or other vitamins and minerals. If you're worried about any deficiencies, speak to your GP to get further advice on this. Orange blood can indicate that period blood has been diluted with cervical fluids or because of infections such as bacterial vaginosis or trichomonas. These infections can lead to discharge, which is often grey in bacterial vaginosis or greeny yellow in trichomonas. The discharge from these infections can mix with the bright red period blood and result in a more orangey looking blood. Other symptoms of an infection include pain or burning in the vagina, a fishy smell, pain when peeing, or redness. It's really important if you have orange blood to speak to a GP, as both of these infections need to be treated with antibiotics. Grey blood can be because of bacterial vaginosis. This is where the acidity levels of the vagina change and can lead to an imbalance or overgrowth of certain bacteria. The grey color occurs due to a collection of bacteria, white blood cells, and cellular waste, which gets carried out as vaginal discharge. Other symptoms of bacterial vaginosis include a fishy odor, pain or burning in the vagina, or pain when peeing. It's really important to speak to your GP if you experience any of these symptoms, as bacterial vaginosis needs to be treated with antibiotics. Finally, a quick summary. The reasons for the color changes in your period may be natural because of hormones, or harmful because of infections or underlying health conditions like anemia. It's important that you get the correct medical advice to help you deal with any problems that you're having. And don't forget to use Luna's symptom tracker. This can be quite helpful information to show your doctor.